Hello, everyone, and thank you for attending today's webinar, which is COVID-19 Workplace Town Hall. My name is actually Holly Foxworth. I'm a registered nurse with Axiom Medical, and I'm joined by several amazing guests, which I'm actually going to introduce to you shortly. For those of you who are new to our webcast or new to Axiom Medical, I'd first like to welcome you and offer some assistance if you need it. We understand those challenges that you're facing as employers trying to maintain business operations while also maintaining the health of your employees. So Axiom has actually developed a rapid response COVID-19 program that we'd be more than happy to make available to you and your organization. This covers everything from support with COVID-19 safety and HR policies to also 24/7 telephonic medical screening and management of ill or potentially exposed employees. And then on the back piece of that, should you have an employee that has to be out of work, then we offer services that would help them return to the workplace. So if you'd like more information about that program, please feel free to submit a question to us in that Q&A box or visit our website, which is Axiom, AXIOM, So I'd like to go over just a few housekeeping items with you guys. At the bottom of your screen, you'll notice that there's multiple application widgets that are there for you to use. All of those widgets are resizable and movable. So drawing your attention then to the right-hand side of the screen, you'll notice that we actually are hosting a webcast for this next week, and that is actually redefining return-to-work processes in this COVID-19 era. So if you guys will just go ahead and click on that Register Now button, that'll get you signed up without having to enter any additional information. We'd love to have you join us. Obviously, this is a town hall, so we want to know what's on your mind. We want to hear your questions, and so please feel free to submit those throughout the broadcast using the Q&A widget. Should we run out of time or a more detailed explanation is needed, we'll definitely follow up with you after the broadcast. A copy of today's slide deck is available along with some additional help resources that are there in the resource list. And then you can find additional answers to some of the technical issues that are located in the help widget. And finally, an on-demand version of this webcast will be available after the broadcast today, and so you can access that by using the same link that was sent to you earlier. So I'd like to go ahead and thank all of you for submitting questions in advance for today's town hall. We're definitely going to get to those shortly, along with those that you submit in the Q&A box. But before we do that, I think it's important that we all recognize, the value that comes in learning from shared experiences, and especially those that come from people that are really working well and perhaps can be implemented in your place of business. So we've actually invited a special guest to join us. His name is Malcolm O'Neill. He's the Vice President of Human Resources at BJ Services. And just to give you guys an insight into Malcolm, he's truly somebody that's on the front lines from a business perspective and has really been a visionary in terms of being proactive and active management of COVID-19 and really maintaining a safe and healthy environment for their employees. So Malcolm, at this point, I'll go ahead and turn it over to you if you'd like to give us an idea of what's going on at BJ Services.
All right, excellent. Thanks, Holly. I'll just do a quick check to make sure you can hear me okay.
I can, yes, thank you.
All right, excellent. Well, I'd like to say just good afternoon to the team out there. I appreciate it. You guys letting me share a little bit about our partnership with Axiom. And so very much I would say that I probably should have read your intro slide a little bit more because it probably would have let me organize my thoughts a little bit better. But when I think about what I wanted to share, just to kind of briefly share with the town hall today, I think too with where I would say the framework of how we've approached our partnership here with Axiom is obviously there's a big, I always say too, is Axiom my OcMed partner or are they really my technology partner? And, and I think for us, and it's not just think about how do we take out the administrative waste, but in the context of just these unprecedented times, and for those of you, I guess I should back up. BJ Services, oilfield service company, 2,400 employees, primarily in North America, or not primarily, but in North America, primarily in the lower 48. We have a headquarters location here in the greater Houston area with roughly 300 to 400 employees, but then the bulk of our employees are field-based in pretty much 40 of the 50 states in every major oilfield basin here across the continental and also in the Calgary area. So one of the things too that we've been really, focused in on is how do we unlock value during this process? And so that's very much kind of my first bullet there is that while we have these really unprecedented times, what are we really looking to do both in the crisis as well as long term? And what Axiom has really helped us unlock is that our crisis response is being built into our current plans and programs. And I'll speak a little bit more to that on the next slide, but I can't underscore the fact that we're running our business today. Our partnership with Axiom today is the same level that we would have been running it pre-crisis, and also how we envision running it post-crisis. The second piece is we are definitely, as we've been thrust into telework, so has our entire organization. So we are really, I would say, accelerating our digital channels. We're deploying new tools rapidly. And also, too, when I think about where we're going, we are definitely not trying to look in the rearview mirror. We are looking straight ahead and thinking about the new normal, and really seeing around the corners, really pulsing what our clients, the large majors that we work for, what they are asking and how we can continue to differentiate ourselves. And we used to think about, Axiom being a kind of a back office, or ACMED being a back office support. It really has allowed us to provide what I would always say is we're providing better decision support to our business while lowering our costs. And even in the midst of a crisis, being able to have that type of partnership that we can say out loud is just tremendous. But I would be remiss not to, the bullet here at the bottom is to not speak to, it does though create a sense of, safety for our organization. It is very heavy-handed, it's paternalistic, it's guiding. And because we know that if our business will not function if our people don't feel safe. In addition to feeling safe at work, it's even that their families feel safe. And so I think that's been a really critical piece for us. So kind of using that as a framework, what I have is just one slide that I really wanted to share with you. I'll advance the slide here. And this slide right here is actually from yesterday's board update. So we've had our second kind of emergency board meeting. We're a private equity-backed company, but, with our sponsors. This was the update that we provided to our board, and I thought it was just a tremendous way to just kind of take you guys on a quick walk at a kind of 30,000-foot level of the proof points. So again, a little bit of framework is we are still operational. I noticed on the call here there's several other oilfield service companies, but we fall into a designation from the Cybersecurity and Infrastructure Security Agency, which is part of the Homeland Security, as a essential critical infrastructure worker. So our organization is still working, even though that we are seeing these municipal and these statewide shelter-in-place models. Our organization, our workforce, is still conducting business travel. We have a permission letter out there that allows them to continue to travel in and out of the workplace to maintain business operations. So we are still actively running the business. But when I think about the protocols, if I didn't have a slide here and I didn't have a visual aid, I would just say, the title of this slide would be "Follow the Doctor's Orders." Where I think all of a sudden we woke up one day called COVID, and we said, really, do we have a partner in the occupational health space, or do we really have a chief medical officer as a service? And, I know Dr. Cherry will be on here shortly, but I could not, from our entire leadership team, we have really all quickly gotten to know Dr. Cherry by first name. And even though, I put a quip out there, even though none of our employees call him their family doc, Axiom and the entire staff very much feels like our organization's family doc in terms of what we've been able to do. And so when we think about our toolbox, what we've been able to do is really that first piece around the COVID readiness and the COVID return to work is we've launched what we call our Contagious Respiratory Illness Protocol. And for those of you familiar with any type of field-based work, we have a protocol called Journey Management, where as part of our Journey Management program, we've actually been able to put a pre-assessment that we've developed in conjunction with Axiom to basically pre-identify a protocol that's captured electronically. And you see the numbers below. These were yesterday's numbers. We've had 83, roughly, a little bit, I guess I'm doing the math here. About 3% of our organization has fallen into this protocol so far, and we do anticipate that number spiking. But being able to manage that organization in such a way that we are able to know who needs to be in a 3-day isolation, who's going to fall into a 7-day isolation, and so forth. And then in addition to that, we've been able to have consultations with Axiom to really help us develop our facilities, our management protocols, our Alpha Bravo rotations. We have a Charlie company that went instantly into telework. So when we think about managing a population health, have really been able to do that. And so a constant question that we heard back from our sponsors were,
I might need to
okay, you're making decisions.
Who I am on the call-in.
Yep, we certainly will. And what we'll do is, what we were able to do is respond back to our sponsors with that update that we were able to basically pick up and go straight to having a medical consult, because their question was, you're making decisions fast, but are they data-based decisions? And we were able to say, yes, not only are they data-based, but they're clinically evidence-based decisions. So that was a really big win for us to be able to have that type of decision support very early in the design of our program. But also, I would say perfect was the enemy of good here. You know, we definitely were moving fast, but I call it moving fast with a plan. And then the other piece too, what I would share is what we've been able to do through these communications, or take advantage of the multimedia that Axiom has out there and start to then, I call it COPE, create once but publish everywhere. You know, Axiom created it, but we've been publishing it internally so that we've been able to basically word this in such a way and present it in such a way that Axiom is our medical service talking directly to our employee base. And, you know, we've been able to take advantage of that so that it really does create that sense like, wow, there's a comprehensive offering right there. And so what I wanted to do today was just, you know, everything that you heard Holly mention earlier about in terms of what services Axiom has. I'm kind of a living proof example that, you know, 7, 8, 9 days ago, this was still on a proverbial dry erase board in our heads with a lot of phone dialogue. And now we're in a daily cadence where we get a live management feed that's cut by basin, you know, so that we really, as we anticipate a higher spike in the number of folks that are presenting with symptoms and, you know, obviously having to manage the logistics of that, we have a management system now that is built for purpose and ready for us. And so what I wanted to do was just kind of take a pause right there. I saw 1 or 2 questions come in. I know there'll be some questions at the end, but I'll just give a little bit more about, you know, the medical screening that we did a little bit in terms of our piece. Ours was a question based off the CDC guideline. And you can see down there in what we call our toolbox, we actually do ours through a app where it's actually each employee is actually reporting out their responses to their supervisor. And then the supervisor then triages those and they get escalated up that based off their responses would then trigger an automatic phone call into our Axiom protocol there. So, you know, Holly, this was just a little bit of me just opening up, wanted to share a little bit of our background of what we've been working on. And I'll certainly turn this back over to you guys, and I'll stay on to the end if there's any Q&A. But, you know, again, thank you for the opportunity to share a little bit about our success so far and kind of the toolkit we've built, you know, kind of in the moment, and, you know, look forward to being able to continue to share to this community how it's working.
Absolutely. Well, thank you so much. That was fantastic. We appreciate you joining us today. And audience, obviously, if you have questions as well for him about what they're doing at BJ Services, we'd like to go ahead and extend that to you. I think he said he'd join us for the call and he can answer some of those questions if you have them. At this point, I actually would kind of like to go ahead and open it up to you guys and tell us what percentage of your business is actually still working in the field. You know, are your employees still in the factories? Are they in the warehouses? Are they driving trucks? Tell us what's going on. I know we have a lot of telework that's going on outside of some of our businesses, but tell us if you really have employees that are actually there and still doing the job. We want to see what's going on. We'll give just a few seconds to respond to that. And after that, we're actually going to be bringing on Dr. Cherry. I know that you guys have lots of questions for him. Okay, so let's take a look here. Okay, so the majority, let's see, it looks like the majority have over 75%. Malcolm, I'm sure that you guys can relate to that as well. So thank you for those responses. We'll go ahead and move forward. Dr. Cherry, are you on the line?
I am. Can you hear me?
Yes, absolutely. So for those of you that don't know who, and I didn't speak of him in the very beginning, but this is Dr. Scott Cherry. He's our Chief Medical Officer here at Axiom Medical, and he's actually going to be answering some of the town hall questions that were submitted. The nurse in me wouldn't let him get away from it if we didn't ask him to first cover some of the best practices for COVID-19 and protecting yourself and also the workforce. So before we get into the questions, can you just kind of review some of the best practices there that we all just need to keep in mind?
Certainly, and you know, so it's a mix of personal and environmental practices, and so obviously personal hygiene is paramount now, and so obviously washing hands for at least 20 seconds with soap and water, or using a sanitizer if possible. is really the forefront of this. And then, if you're feeling sick, you definitely don't want to go out into public, definitely don't want to come out into work. And so you want to engage in social isolation. That's one of the most effective strategies in slowing down the transmission of this pandemic. And then when you look at personal hygiene, it can be a mix of, if you're sneezing, coughing, you want to use a tissue, or if you don't have anything on you, potentially into your elbow. You really don't want to sneeze into your hands, because that's one of the primary transmission modes where those infectious particles go onto your hands and then go on to other more common components into the environment. So like doorknobs, tables, other common areas. And so, if you do feel sick and you need to go in to seek medical care, putting on a surgical mask will really help prevent the spread of those germs. And then, looking at environmental cleaning, the way we think about these infectious particles, they potentially will stay in the environment for about 24 hours. And so if you can do daily environmental cleanings with a EPA approved disinfectant, that's really good. If you can do it twice a day or more, that's really better. And so those are really kind of the common sense approaches to, the personal hygiene and environmental hygiene that we want to recommend.
Fantastic. Well, Dr. Cherry, we'll go ahead and advance to some of the questions that were submitted, if that works for you. Mark had actually wrote in and asked that if a person tests positive for COVID-19, when are they cleared to return to the work? And then also, if you have a member of the household that tests positive, when is it safe for that employee to return to work?
Sure. So, this guidance has been evolving since the beginning. We originally were using the original CDC guidance for return to work. So once your symptoms resolved, it would be a 24-hour time period, then you could return to work. And that's really kind of repurposed guidance from the flu, the annual flu outbreaks. And so now, based on new data coming in from Italy and China, the CDC guidance has evolved, and it's much more, it's much longer, and it has some extra components to it. So we're shifting from a 24-hour time period symptom-free to a 72-hour time period of being symptom-free. And then additionally, you have to wait at least 7 days from the time your symptoms started before you can return to work. So it's kind of that two-tiered approach. And then your second question was looking at if you had an exposure in the home, how does that affect return to work? And so if you're asymptomatic, but yet exposed to someone with an infectious respiratory disease, really you want to go on a 14-day isolation period, because that's the incubation range that we've been seeing in COVID-19.
Excellent. Okay, so we'll go ahead and take you guys to one additional poll question. Let us know, do you have an established COVID-19 return to work process that's in place? We'll give you just a few seconds to answer that. And then Dr. Cherry, you've helped with establishing a lot of these policies and procedures. I'm sure you may have some additional guidance that you'd want to share on that. We can get to that later in the presentation, but definitely we want to know from you guys, do you have an established COVID-19 return to work process? We'll go ahead and take a look. Let's see. Okay, so that's close to 60% say yes. Okay, and like we said, like I mentioned at the very beginning, not to reiterate yet again, but if that's something that you want to talk through, we're more than happy to help you with that. And especially this next week, we've got a webinar that's coming up about redefining that. I think you're going to be joining us for that as well, Dr. Cherry. Okay, so for the next question, yeah, I didn't mean to cut you off. Was there something else that you wanted to say about that as well?
Oh, no, just a quick comment. I look forward to participating in that.
Oh, perfect. Okay. So the next question we got in was actually from Alan that had asked us, he had mentioned that they had an employee that had said that they were told by their family doctor that you couldn't be positive for flu or strep and COVID-19 at the same time, wanting to know, is that true or false? What's your thoughts there?
Yeah, that's an interesting question. When you think of co-infection, I think that's kind of the root of this question is, can you be infected with more than one type of disease? You really want to think about, well, yes, infections are opportunistic, and so they're going to look for hosts that can allow them to play out their life cycle. And so many times in medicine, you'll see infections with multiple bacteria or viruses potentially. And so I think data right now supporting that is lacking, but I would think that there is a high potential for co-infection. And so a lot of our return to work and screening protocols are looking at symptoms concerning of any contagious respiratory infection.
Okay. Hey, as a side note to this, we've seen some data recently that's been talking about people that have symptoms that were specific to limiting of taste and smell. Could you maybe add a little bit to that? I'm sure others have heard that as well. Is that a new symptom that's associated with COVID-19?
I have seen that, and I haven't seen that as a formal evidence-based study. I've seen anecdotal reports, and then I think there's an article that's been circulating, and so that's a very interesting anecdote, but I wouldn't hold it as being predictive or evidence-based, and so I'd be somewhat guarded to implement it in a population health screening program, but definitely it's good knowledge for those to be aware of.
Okay, excellent. All right, well, our next question came from Gary, and he had a question about the N95. He mentioned that if they have an employee that actually brings in their own N95 respirator for COVID-19 protection, but they haven't been fit tested and the mask is not required for their job function, is he actually required by OSHA to tell the employee that they may not use that?
So voluntary use, OSHA has addressed historically, and so I would say this clearly falls under voluntary use. And just to be clear to our audience, voluntary use is where PPE may be utilized when it's not formally indicated based on a hazard assessment. And so in this case, employees are allowed to bring in or utilize PPE that is not formally recognized as needed based on permissive exposure limits or other types of industrial hygiene measures. However, employers still need to be supportive of those employees. Specifically regarding this question, because it's a filtering phase piece, they do not need to go through the formal fit testing or respiratory clearance, but they do need to receive some basic training on, you can use this type of respirator for your general practices, but it will not protect you from all hazards in the workplace in case they go into other hazardous areas that they're not normally used to. But it is available for them to use. Okay,
thank you. Our next question came from Sean. I love this question, actually. He'd mentioned that he's an HSSE coordinator and is looking at taking temperatures of employees before they're allowed to proceed to the workplace. What is the recommended temperature that would be considered a fever for the COVID-19 screening?
Yeah, this is a great question, and it brings me back to either med school or doing my residency where, just because someone has an elevated temperature, it does not necessarily qualify as a fever. And so the definition for a fever in medicine is a temperature greater than 100.5.
Okay, all right. So 100.5. We'll go ahead and ask you guys, are you implementing some of these pre-work screening processes, such as taking temperatures before shifts, things like that? Tell us what you're doing. Are you getting proactive in that way? We'll open that up for a few seconds to respond. Okay, let's see. Go back one more time. Okay. So the majority are not, but I'm actually kind of surprised that it kind of is almost a 50-50 split there. Is that what you were expecting, Dr. Cherry?
It's hard for me to predict what I think now. In my bubble, it's all about workplace screening. So in a lot of ways, I feel like it should be very commonplace. But to be truthful, if you really look from a distance from this matter, yeah, I bet a lot of employers are not engaging in workplace screening. I was reading an article earlier this morning that our CFO had released to us, and what shocked me was how many companies were shutting down operations just to protect their employees. And so it made me realize that there's a huge opportunity for employers to consider workplace screening as one of the forefronts or proactive measures before considering shutting down their operations.
Absolutely. Maintain business. Okay, we'll go ahead and proceed to the next one. Monica had asked if you could maybe just kind of explain further pre-existing conditions and how they're associated with COVID-19. She had mentioned that she'd heard that some hospitals are not treating people with underlying conditions, including children, addressing only the healthy ones first. Do you have some additional thoughts you'd like to share here?
Certainly, and so when we look at those at highest risk for severe disease, or maybe I'll back up a little bit, and so I think we need to provide some perspective about COVID-19 and how many cases we expect to have in the US or the world. And so it being a respiratory disease that's very contagious, by far the majority of Americans, or at least a significant proportion, will actually end up having been exposed to it or being considered positive for it. However, what we should be focusing on is what percentage are having severe disease and what are the risk factors for severe disease. And so the experience we've been seeing from China, Italy, and some of the other areas of high transmission is that it seems that there's certain risk categories that are much higher for severe disease or even death. And so those categories right now are those that are of older age, and I've seen either greater than 60 or 65 is that cutoff, and then those with chronic medical conditions. And so the main ones that they've been tracking are diabetes, cardiovascular disease, and chronic respiratory disease. And so I think her question also was addressing potentially how those risk factors may be addressed in the hospital setting. Is that correct?
Correct. Right. Yeah. I think she had heard maybe that there was some that there was question as to whether the hospital were maybe taking those that didn't have. They were addressing first the healthy ones versus those that had the pre-existing conditions, and was asking was there truth to that?
So I think for routine operations, the health system will address any and all that come in the door for treatment. And so in some of the areas that have been truly overwhelmed by the demand, it's probably a very difficult assessment that every hospital or every area has to truly look at. And so once they've become overwhelmed, I think there's probably not a rule for them to follow. And so that's a good question, but in general, I think our measures here in the U.S. are to try to prevent the overwhelming of the health system to where those dire results or those dire scenarios don't play out.
Okay. We'll go ahead and advance to the next one. Robbie had asked, I've heard that many people are becoming ill with COVID-19. Is it due to the increased use of vaping in our nation?
That's an interesting question. I have seen case reports of severe disease in individuals by which you would not have predicted. So someone who's young with no chronic medical conditions, based on the experience out of, again, those high transmission areas, those are usually low risk individuals for severe disease. And so I've seen at least a couple of case reports where vaping was associated with severe disease. And so I don't think we have enough data to say that it's a risk factor at this point from an evidence-based perspective, but it's definitely something to be keeping our eye on.
Okay. And let's see, Rhonda had asked, can you explain how medications are being tested for treatment of COVID-19?
Yes, so this is interesting. So right now there's no FDA-approved medication to treat or to slow down the disease in COVID-19. And so in general, for viruses, you would either utilize a vaccine like the annual flu vaccine that we get every year, or antivirals that can kind of slow down the spread or slow down the symptoms or the duration of the disease in individuals. And so right now, a lot of hospitals are doing what they call off-label use of other medications that may be effective. And so I think right now there's been good traction with a couple of medications. One's chloroquine, which has traditionally been used for an antimalarial, as well as an antiviral utilized in HIV.
Okay. And are they using those in conjunction with, it looked like I saw something about they were maybe using those in conjunction with the Z-Pack as well, or?
So our experience from flu pandemics, specifically like the 1918 Spanish influenza outbreak, what we saw there was that patients didn't die from the viral infection, but they died from a secondary bacterial pneumonia. And so you want to be very aware of that. If your symptoms aren't improving, or if you develop worsening of symptoms and shortness of breath, you definitely want to seek medical care sooner than later. And so that's why you'll see antibiotics utilized in conjunction with those other medications we were speaking about.
Okay. Well, we've received a lot of questions while we've been in the town hall here, so I'll go ahead and just kind of proceed to ask you some of these if you can answer them. Let's see. We've had a lot have asked. Let's see, including Elizabeth. Where can someone get tested?
So testing has been an interesting or developing situation here, and so early on with this outbreak, testing was extremely limited, and I would still say at this point it's still very limited, and you do see more resources opening up from either the CDC, public health departments, and now commercial clinics, as well as the classic lab services that we're used to getting from like LabCorp and services like that. However, still testing is limited, and so you may face not being able to get a test if you don't meet those high-risk categories, or if you're not symptomatic. And then another thought about being tested is that I can understand the concern about knowing your status, and I think more testing will be very helpful, but it's not the end-all be-all. Obviously, if you take a test today and you're negative, if you go out tomorrow and get exposed to someone who has it, then you're still kind of in that questionable kind of time frame. So testing is going to be really going to provide a lot of information about how do we move forward with this, but there's going to be limitations to access, as well as once you get a test that's negative, what do you do the next day after when you're still facing the same risk of being exposed?
That's a great question. So just still promoting the isolation then if you've been exposed or if you have symptoms, correct?
Correct.
Okay. All right. The next one, let's see. Bill had asked, for companies that are working from home, what is your current end date? As an example, our current end date is 4/17. We will make a decision prior to that if we plan to extend it. So I think maybe Bill's asking about, for those that have sent their employees home, do you have an anticipated end date of when something like that would change?
That's really a very localized decision, and probably a very specific case-by-case business decision. In general, you would want to look at transmission rates in your area of operations to determine, what's the risk to your employees. And so obviously right now we're all embracing general recommendations to stay at home to help prevent general transmission in our daily lives. And so really it's going to be a personalized assessment for every operation and every company out there.
Okay. And then Bart had asked, has there been any studies done as to whether the virus stays airborne for a certain period of time once someone coughs, et cetera?
Maybe we can back up a touch and talk about how infectious diseases can be transmitted. And so for respiratory diseases, we always can think of airborne as the primary, and I always default to the most scary way something can be transmitted. I think you see that in a lot of movies where you walk into a room that someone may be infected, and so you're instantly infected, and then it's a very dramatic ending. But airborne is a very specific type of transmission, and technically COVID-19 does not meet the criteria for airborne transmission. It falls under the next stage of transmission, which we would call droplet transmission. And so the difference between those two types of transmissions are that droplet transmission occurs when you're speaking, or if you're coughing or sneezing. You're going to have small respiratory droplets of body fluid, mucus, saliva, things like that, that will come out of your mouth and go out into the environment, but then quickly settle out of the air and then rest onto kind of the general environment. So the table, the floor, just different objects in the environment. And so, technically it's not going to stay long in the air. The studies I've reviewed show that it may stay in the air for minutes, maybe to about an hour, and but it's really not considered airborne, where the classic example would be measles, where if someone came into a room that was infected with measles and then left, infectious measles would be in the room for hours or even a day or so. So it's a much shorter time frame, and so the real risk is not infectious particles in the air, but in the environment in droplet form.
Okay. Mark asked a great question. Are our employees really safe if they are in an enclosed space that are practicing social distancing? There's been a lot of talk about this one. Maybe you can kind of give us some more insight.
Yes, so I would say, yes, that's a very safe space to be in. And so, if you're, I guess we can look back at the CDC definition for close contacts. And so one of the highest risks of transmission is what we call by close contacts. And the CDC is currently defining that by time and distance. And so the distance component is within 6 feet, and then the prolonged time period we've defined as 15 minutes. And so, if you're spending close time with someone, which we would be considered close contacts, that's relatively a high risk behavior, especially if one of the persons is infected. And so if you're by yourself in a closed space, that's relatively safe. The only caveat I would say is if that space actually has those infectious particles from someone else that may have been in there previously, that would be maybe your only risk. And so you want to do a good environmental cleaning if you're not aware, or if there was a concern of someone being sick in that space previous to that.
Okay. Let's see. Neil brought up a great question and mentioned that voluntary use under, let's see, he gave the specific reference, but anyways, what he was saying was that personnel should take a temperature screening, should have basic training to do such. So if people are implementing that in the workplace where they're screening employees, do you have some thoughts as to whether someone needs to have basic training, or what type of training would they need to have for such?
Yes, and is this regarding temperature taking or other measures? Yes, and so I believe we've gotten some formal guidance from regulatory bodies that have allowed, broad screening of employees about taking temperature in the workplace, and maybe even in common areas for certain businesses. But definitely you want to be, the people taking those temperatures should be trained specifically on the device they're using. And so it doesn't need to be necessarily an extensive training, but definitely having some training about how to operate the equipment, make sure it's calibrated if there's such an option, at least daily or whatever the manufacturer recommends. But that's a great comment, and I appreciate that reinforcement to the group here.
For sure. Gerald had asked, have there been any studies on how long the COVID-19 survives on a solid surface?
There actually has been a recent study released about how long the virus would be viable on different mediums or materials. And so they looked at a host of materials from like cardboard or different metals like copper, stainless steel, plastics. And so I did read that study recently. The general take I took from that was that regardless of any of those substances, there was a difference between them, but overall, based on the half-life range, almost every substance would be cleared of the virus after about a day or so. And so that's one reason why we recommend at least once a day environmental cleaning or twice a day if possible, because that way you're going to get that virus before it will, you can basically disinfect the virus before it's going to peril on that medium. So. Okay.
Julia had asked, we've had an issue with employees actually being tested. In our area, they're being told to go home and self-isolate and assume you have the virus. Only under circumstances are tests being given. Is this common?
Yes, it's common. I think still testing is very limited, and so the healthcare authorities or healthcare providers are going to limit those tests to those high-risk groups that will actually provide them actionable information. And so we talked earlier on this topic where, say, for instance, you have diabetes and you're in the age category for high risk, so those groups would be, there's a much better value from the healthcare provider perspective to look at if this person's positive and then they're high risk for severe disease. We would be much more quick to act once they become symptomatic. And so it doesn't surprise me that we're still going to see people who are relatively healthy, and especially if they're asymptomatic, to be denied a test.
Okay, that's great. We also had one from Maureen. If you decide to have employees' temperature taken, let's see, should the person taking the temperature be outfitted with a mask, gloves, or protective clothing?
I think that is a good recommendation. And so it depends if you're going to consider them a healthcare worker or not. But, looking at, if someone's going to spend all day long taking temperatures, things of that nature, I would recommend that they do wear protective equipment such as like an N95, some goggles, and some gloves as well.
Okay, great. Brianna had asked if you could talk maybe a little bit more about the telephonic medical screening perspective.
Sure, and I can talk specifically about our process. When COVID-19 was starting to show it was going to be the high likelihood of it being a pandemic and spreading from China or from other countries into the US, we were considering how do we help enable our clients to continue operations when potentially most people, or at least a high proportion of people, 40, 50, 60% of the population may be exposed. And so we looked at the World Health Organization's final report in Wuhan, looking at their most common symptoms associated with this disease, as well as the highest risk transmissions that were documented. And so we took those lessons learned and incorporated into a comprehensive screening program that allows us to quickly and efficiently assess somebody when there's not laboratory confirmatory testing. And so especially now being an unprecedented time of this pandemic, if we can embrace a posture where we're going to really focus on protecting the employee at the expense of some false positives in the screening program, I feel that's the best protocol to follow. And so false positives are when you're screening for something of interest and the screening process inaccurately labels them as a positive, even though they do not have that outcome of interest. The balance is no screening tool is 100% sensitive or specific, and so there's always going to be a balance of false negatives and false positives. So a false negative is where someone actually has the disease of interest, but we falsely label them as they don't. And so we've decided at Axiom Medical to have a screening tool that really biases the screening effectiveness towards false positives in lieu of false negatives. And that way we're ensuring that no one that actually has the disease is in the workplace. And so really it's a mix of all the risk factors that the World Health Organization's final report showed were one, it's symptoms, it's travel history, and then it's also exposures. And so some of the most high-risk exposures. The highest risk was clearly taking care of someone sick in the household, and so it's a non-professional healthcare worker. So, for instance, someone who's not formally trained in healthcare work, who has a spouse or a child that's sick, they had a very high likelihood of becoming positive and symptomatic themselves. So we took basically all three avenues of risk for getting the disease. And again, that's exposure from close contacts, travel to high transmission areas, and then symptoms consistent with COVID-19.
Okay. Sarah asked a really great question. She'd asked, is there a requirement to inform employees or customers that someone at your facility has tested positive or is suspected to be positive?
Let me think through that for a second. A requirement. I'm not sure if it's a hard requirement, but I would definitely say it's best practice if it's not a requirement to for an employer to advise their workforce if there was a confirmed case in the workplace, especially for close contacts. And so we can help assist with contact tracing and determine who is at high risk for exposure based on that positive case.
Okay. Maureen had asked just a follow-up on the protocol there. If you have an employee with a confirmed case of COVID-19, what is the protocol before business can resume? Should you send all employees home, and if so, for how long? And should you have a professional cleaning service disinfect the facility, or you have existing employees clean? She asked several questions, so I'll let you go ahead and tackle those, and then we'll get into the others that followed that.
Oh, yes. So, if you do have a confirmed case of COVID-19 in your workforce, I think the most specific actions you could take is do contact tracing and do an investigation to see who they came into contact with, when they became symptomatic, and so you can start doing like we call it an epidemiologic kind of investigation, or I think a lot of times in our industries we look like a root cause investigation, but you really want to just backtrack to see who had close contact. So, casual contact, things like that don't count, but you want to look at close contacts. And so, if you don't have that expertise in-house, we can, help you with that as well. And but I would say you don't need to shut down operations just as soon as you have one case in the workforce. You can have a much more deliberate and specific and measured approach about looking at who should we get tested, who should we be screened. And so that would be the next step for those close contacts, is have them screened to see if they have symptoms, and we can move forward from there.
Yeah, the next piece was, should you have a professional cleaning service disinfect the facility, or can you have existing employees clean?
My recommendation is to have professional cleaners do it if at all possible. And this may be a mixed approach to where you have that professional cleaning once or twice a day, and then you train your employees how to appropriately clean the common places that they're in and things like that too. But as long as they're trained, it's probably okay, but I still recommend professional cleaning.
Okay. And the last part of her question was, what training or precautions are necessary for the employees if this is the option selected? So I assume that she's speaking about if you were to have employees that were actually going to clean the facility, what training or precautions would be necessary?
Yeah, so I would definitely say they need to be trained in what we call contact precautions. And so they want to use protective equipment that, as they're going to be engaging in potentially infectious common areas where they're going to be cleaning, it's basically called contact precautions, where you're going to wear gloves and you're going to be able to put those gloves on and off in a very clean and almost sterile manner, and not touch your face, and so there's probably several steps, but you want to look up contact precautions.
Okay. And then let's see, Michelle had asked, drive-throughs are still open. Would you consider it high risk that food service workers can transmit that virus onto food especially if carrying but not yet showing symptoms and therefore not taking precautionary measures?
Yeah, this is a great question. You know, obviously, when we're engaging into social isolation, I think that takes the bulk of the risk away. So obviously, sitting in a crowded restaurant is something you don't want to do. But so now the next step is, you know, let's risk assess a drive-through, right? And so that's a great question with some extra details there that I was thinking about as the question was being read to me. And so I think it's about the definition of close contact. So if you can if you can prevent close contacts, I think that's the best posture available for everyone out there. So I think you can get that transaction done, you know, pretty quickly. So you definitely want to, you know, I think the distance, if I roughly estimate, is probably between 3 and 6 feet. So you technically meet the distance requirement, or you're inside the danger zone from a distance perspective. But if you can get that transaction completed before 15 minutes, I would say it's relatively safe. Another thing is that it's also the behaviors during that close contact. So if you're directly facing each other and you're talking back and forth, and you know, again, we have these rules that are very binary. So it's, you know, within 6 feet or within 15 minutes, but really it matters how close, right? So 1 foot is much more dangerous than 5 feet, and same thing with time. So I think you're probably okay if you're not really spending a lot of time directly facing them while they're talking, they're not directly facing you, and that if you can just keep time at a minimum, I think you're relatively safe.
Okay. We'll ask one more question. Then I think that we had some that had came in that had asked about disinfecting questions, and maybe they wanted some insight from Malcolm as well. So let me go ahead and just ask you one more question, then we'll close it out with Malcolm, if that's okay with you, Malcolm, if you're prepared for that. The last one was, let's see, how long could someone have contracted COVID, and will influence future practices as a business for managing infectious disease in general? I think maybe they're talking about some of the practices that we're looking at in terms of future facing, and you know, some of the practices that we've implemented now, and how will that move forward with what we face in the future.
That's something we've been thinking about at Axiom. And so what's interesting is COVID-19 in some ways is similar to the flu. The ways it's different is that the amount of severe disease it's causing is at a much higher level, and so it could easily be 5 to 20 times the amount of severe disease that we see in the annual flu outbreaks. And so I know some workplaces do have a culture that embraces, hey, if you're sick, do not come into work. Or if you come in sick, your coworkers will tell you to go home. And so I think that culture is going to either develop or be reinforced in a lot of companies that are wanting to do best practice about employee health and preventing the spread of infectious disease. And so I'm hopeful that the negative side of COVID-19 is quite apparent from an economic and health outcome perspective. I'm hoping, though, that we take these lessons learned and incorporate it into our forward-facing culture of health.
Absolutely. Great point. Malcolm, do you want to comment maybe on how you guys are doing some of the disinfectant procedures at your facility?
Yeah. Yes, certainly. I think I saw a couple of questions come through in terms of like the chemicals and, you know, finding the access to them. So we actually had approached our cleaning crew about 2 weeks ago to find out what their protocol was. And they did have within their protocol the ability for us to move over to antiviral cleaning agents. So there are 2 bulk chemicals that are mixed, or that it's in a concentration model. What we were able to do is, obviously we're wiping down all common contact hard surfaces multiple times throughout the day. And what we did is we actually brought on an additional day porter during the day. It's slightly overkill. We actually have less population. We only have about 1/3 of our organization on-prem so that we can reduce our population health. But it is just that flow of having the presence of more personnel wiping that down and has been able to really help the organization feel at ease to be there in the workplace and can certainly follow. We've been going through those same tabletops that Dr. Cherry spoke to about if and when we do have a contact at work, how would we handle that? So very, very aligned with everything we've heard so far.
Okay, thank you so much. Well, I think we'll go ahead and end it with this point again. Just to reiterate, if there's anything that we can do from the support from our end for COVID-19, we're more than happy to talk you through some of those processes and offer some support there, whether that be with your policies, whether it's with screening your employees. And obviously, we're all focused on getting these employees back to work. You know, that's the main goal, is to drive business and keep our economy going. So if we can help you in any way, please reach out to us and let us know. Those that needed some additional responses in your follow-ups for questions that you submitted, we'll be reaching out to you after this webinar, and we can discuss those further with you. So we'll go ahead and end it here, unless anybody else has anything else they want to add. Dr. Cherry or Malcolm, either one of you have anything you wanted to end with?
Thank you very much for your participation today.
Absolutely.
Likewise. Everyone be safe.
All right. Thank you all so much. Have a good day.